Crises such as the coronavirus, COVID-19 outbreak can understandably induce an incredible amount of worry and stress on anyone. Fear and anxiety about a disease can be overwhelming and cause strong emotions in both adults and children. The goal of this course is to provide you with practical guidance from the Centers for Disease Control and Prevention, CDC, on how to cope and respond to the stress created by the COVID-19 outbreak. Learning to cope effectively with stress will make you, the people you care about, and your community stronger. By the end of this course, you will be able to define stress and anxiety, identify common signs and symptoms, explain how to reduce stress for yourself and others. Stress is your body's way of responding to any kind of demand put on it, physical, emotional, or mental demands. It is a physical reaction we have to events that take place in the surrounding world, such as those imposed by the COVID-19 pandemic. Anxiety is a rather extreme response to stress, usually characterized by irrational fear and worry. The outbreak of coronavirus disease 2019, COVID-19, can be stressful for many people. Everyone reacts differently to stressful situations. How you respond to the outbreak can depend on your background, the things that make you different from other people, and the community you live in. People who may respond more strongly to the stress of a crisis include older people and people with chronic diseases who are at higher risk for COVID-19, children and teens, people who are helping with the response to COVID-19, like doctors and other healthcare providers or first responders, people who have mental health conditions, including problems with substance use. Stress during an infectious disease outbreak can include fear and worry about your own health and the health of your loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs. People with pre-existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. Additional information can be found at the Substance Abuse and Mental Health Services Administration, SAMHSA, website. Stress during difficult times can affect both your body and your mind. People under extreme amounts of stress can become tired, sick, and unable to concentrate or think clearly. Sometimes they even suffer mental breakdowns. Long-term stress can also have serious effects on your mental health and behavior. If you are under stress for long periods of time, you may find that you have difficulty thinking clearly, dealing with problems, or even handling day-to-day situations. These effects are why it's so important to effectively manage stress and anxiety during the COVID-19 outbreak. Taking care of yourself, your friends, and your family can help you cope with stress. Helping others cope with their stress can also make your community stronger. Sharing the facts about COVID-19 found on the CDC's website and understanding the actual risk to yourself and people you care about can make an outbreak less stressful. When you share accurate information about COVID-19, you can help make people feel less stressed and allow you to connect with them. Here are some actions you can take to support yourself during an outbreak. Take care of your body. Try to eat healthy, well-balanced meals, exercise regularly, and get plenty of sleep. Avoid alcohol, tobacco, and other drugs, and learn more about wellness strategies for mental health. Connect with others. Share your concerns and how you are feeling with a friend or family members. Maintain healthy relationships and build a strong support system. Take breaks. Make time to unwind and remind yourself that strong feelings will fade. Try taking in deep breaths. Try to do activities you usually enjoy. Stay informed. When you feel that you are missing information, you may become more stressed or nervous. Watch, listen to, or read the news for updates from officials. Be aware that there may be rumors during a crisis, especially on social media. Always check your sources and turn to reliable sources of information like your local government authorities. Avoid too much exposure to news. Take breaks from watching, reading, or listening to news stories. It can be upsetting to hear about the crisis and see images repeatedly. Try to do enjoyable activities and return to normal life as much as possible and check for updates between breaks. Seek help when needed. If the stress impacts activities of your daily life for several days or weeks, talk to a clergy member, counselor, or doctor, or contact the SAMHSA helpline at 1-800-985-5990. Children and teens react, in part, to what they see from the adults around them. When parents and caregivers deal with the COVID-19 calmly and confidently, they can provide the best support for their children. Parents can be more reassuring to others around them, especially children, if they are better prepared. Not all children and teens respond to stress in the same way. Some common changes to watch for include excessive crying or irritation in younger children, returning to behaviors they have outgrown, for example, toileting accidents or bedwetting, excessive worry or sadness, unhealthy eating or sleeping habits, irritability and acting out behaviors in teens, difficulty with attention and concentration, avoiding of activities enjoyed in the past, unexplained headaches or body pain, use of alcohol, tobacco, or other drugs. There are many things you can do to support your child. Take time to talk with your child or teen about the COVID-19 outbreak. Answer questions and share accurate facts from the CDC about COVID-19 in a way that your child or teen can understand. Reassure your child or teen that they are safe. Let them know it is okay if they feel upset. Share with them how you deal with your own stress so that they can learn how to cope from you. Limit your family's exposure to news coverage of the event, including social media. Children may misinterpret what they hear and can be frightened about something they do not understand. Try to keep up with regular routines. If schools are closed, create a schedule for learning activities and relaxing or fun activities. Be a role model. Take breaks, get plenty of sleep, exercise, and eat well. Connect with your friends and family members. Responding to COVID-19 can take an emotional toll on you. There are things you can do to reduce secondary traumatic stress, STS, reactions. Acknowledge that STS can impact anyone helping families after a traumatic event. Learn the symptoms, including physical, fatigue, illness, and mental, fear, withdrawal, guilt. Allow time for you and your family to recover from responding to the pandemic. Create a menu of personal self-care activities that you enjoy, such as exercising or reading a book. Take a break from media coverage of COVID-19. Ask for help if you feel overwhelmed or concerned that COVID-19 is affecting your ability to care for your family and patients as you did before the outbreak. Being separated from others if a healthcare provider thinks you may have been exposed to COVID-19 can be stressful, even if you do not get sick. Everyone feels differently after coming out of quarantine. Some feelings include mixed emotions, including relief after quarantine, fear and worry about your own health and the health of your loved ones, stress from the experience of monitoring yourself or being monitored by others for signs and symptoms of COVID-19, sadness, anger, or frustration because friends or loved ones have unfounded fears of contracting the disease from contact with you, even though you have been determined not to be contagious. Guilt about not being able to perform normal work or parenting duties during quarantine. Other emotional or mental health changes. Children also may feel upset or have other strong emotions if they or someone they know has been released from quarantine. The coronavirus, COVID-19 outbreak, and the recommendations to prevent its spread can provoke worry, stress, and anxiety in many people, threatening physical and emotional well-being. Effective coping strategies and support can help you, your families, and your community manage stress and anxiety and maintain a healthy mind during these difficult times.